Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine. Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Risk of autism after prenatal Topiramate, Valproate, or Lamotrigine exposure. Background. Maternal use of Valproate during pregnancy has been associated with an increased risk of neurodevelopmental disorders in children. Although most studies of other anti-seizure medications have not shown increased risks of these disorders, there are limited and conflicting data regarding the risk of autism spectrum disorder associated with maternal Topiramate use. Methods. We identified a population-based cohort of pregnant women and their children within two healthcare utilization databases in the United States, with data from 2000 through 2020. Exposure to specific anti-seizure medications was defined on the basis of prescription fills from gestational week 19 until delivery. Children who had been exposed to Topiramate during the second half of pregnancy were compared with those unexposed to any anti-seizure medication during pregnancy with respect to the risk of autism spectrum disorder. Valproate was used as a positive control and Lamotrigine was used as a negative control. Results. The estimated cumulative incidence of autism spectrum disorder at 8 years of age was 1.9% for the full population of children who had not been exposed to anti-seizure medication, 4,199,796 children. With restriction to children born to mothers with epilepsy, the incidence was 4.2% with no exposure to anti-seizure medication, 8,815 children, 6.2% with exposure to Topiramate, 1,030 children, 10.5% with exposure to Valproate, 800 children, and 4.1% with exposure to Lamotrigine, 4,205 children. Propensity score adjusted hazard ratios in a comparison with no exposure to anti-seizure medication were 0.96, 95% confidence interval, C, 0.56 to 1.65, for exposure to Topiramate, 2.67, 95% C, 1.69 to 4.20, for exposure to Valproate, and 1.00, 95% C, 0.69 to 1.46, for exposure to Lamotrigine. Conclusions. The incidence of autism spectrum disorder was higher among children prenatally exposed to the studied anti-seizure medications than in the general population. However, after adjustment for indication and other confounders, the association was substantially attenuated for Topiramate and Lamotrigine, whereas an increased risk remained for Valproate. Ribociclib plus endocrine therapy in early breast cancer. Background. Ribociclib has been shown to have a significant overall survival benefit in patients with hormone receptor, HR-positive, human epidermal growth factor receptor 2, HER2-negative advanced breast cancer. Whether this benefit in advanced breast cancer extends to early breast cancer is unclear. Methods. In this international, open-label, randomized, Phase 3 trial, we randomly assigned patients with HR-positive, HER2-negative early breast cancer in a 1-to-1 ratio to receive ribociclib, at a dose of 400 mg per day for 3 weeks, followed by 1 week off, for 3 years, plus a nonsteroidal aromatase inhibitor, Cy, letrozole at a dose of 2.5 mg per day or anastrozole at a dose of 1 mg per day for greater than or equal to 5 years, or in Cy alone. Premenopausal women and men also received goserelin every 28 days. Eligible patients had anatomical stage 2 or 3 breast cancer. Here we report the results of a pre-specified interim analysis of invasive disease-free survival, the primary endpoint. Other efficacy and safety results are also reported. Invasive disease-free survival was evaluated with the use of the Kaplan-Meier method. The statistical comparison was made with the use of a stratified log rank test, with a protocol-specified stopping boundary of a one-sided p-value threshold of 0.0128 for superior efficacy. Results. As of the data cutoff date for this pre-specified interim analysis, January 11, 2023, a total of 426 patients had had invasive disease, recurrence, or death. A significant invasive disease-free survival benefit was seen with Ribociclib plus NSAI as compared with NSAI alone. At 3 years, invasive disease-free survival was 90.4% with Ribociclib plus NSAI and 87.1% with NSAI alone. Hazard ratio for invasive disease, recurrence, or death, 0.75, 95% confidence interval, 0.62 to 0.91, p equals 0.003. Secondary endpoints, distant disease-free survival and recurrence-free survival, also favored Ribociclib plus NSAI. The 3-year regimen of Ribociclib at a 400 mg starting dose plus NSAI was not associated with any new safety signals. Conclusions: Ribociclib plus NSAI significantly improved invasive disease-free survival among patients with HR-positive, HER2-negative stage 2 or 3 early breast cancer. Intrathecal gene therapy for giant axonal neuropathy. Background: Giant axonal neuropathy is a rare, autosomal recessive, pediatric, polysymptomatic, neurodegenerative disorder caused by biallelic loss of function variants in GON, the gene encoding gigaxanine. Methods: We conducted an intrathecal dose escalation study of SCAV9/JET-GON, a self-complementary adeno-associated virus-based gene therapy containing the GON transgene, in children with giant axonal neuropathy. Safety was the primary endpoint. The key secondary clinical endpoint was at least a 95% posterior probability of slowing the rate of change, i.e., slope, in the 32-item motor function measure total percent score at 1 year after treatment, as compared with the pretreatment slope. Results: 1 of 4 intrathecal doses of SCAV9/JET-GON was administered to 14 participants, 3.5 times 1013 total vector genomes, VG, in 2 participants, 1.2 times 1014 VG in 4, 1.8 times 1014 VG in 5, and 3.5 times 1014 VG in 3. During a median observation period of 68.7 months, range 8.6 to 90.5, of 48 serious adverse events that had occurred, 1, fever, was possibly related to treatment, 129 of 682 adverse events were possibly related to treatment. The mean pretreatment slope in the total cohort was -7.17 percentage points per year, 95% credible interval, -8.36 to -5.97. At 1 year after treatment, posterior mean changes in slope were -0.54 percentage points, 95% credible interval, -7.48 to 6.28, with a 3.5 times 1013 VG dose, 3.23 percentage points, 95% credible interval, -1.27 to 7.65, with a 1.2 times 1014 VG dose, 5.32 percentage points, 95% credible interval, 1.07 to 9.57, with a 1.8 times 1014 VG dose, and 3.43 percentage points, 95% credible interval, -1.89 to 8.82, with a 3.5 times 1014 VG dose. The corresponding posterior probabilities for slowing the slope were 44%, 95% credible interval, 43 to 44, 92%, 95% credible interval, 92 to 93, 99%, 95% credible interval, 99 to 99, which was above the efficacy threshold, and 90%, 95% credible interval, 89 to 90. Between 6 and 24 months after gene transfer, sensory nerve action potential amplitudes increased, stopped declining, or became recordable after being absent in 6 participants but remained absent in 8. Conclusions: Intrathecal gene transfer with SCAV9/JET-GON for giant axonal neuropathy was associated with adverse events and resulted in a possible benefit in motor function scores and other measures at some vector doses over a year. Further studies are warranted to determine the safety and efficacy of intrathecal AV-mediated gene therapy in this disorder. Anti-interleukin 23 autoantibodies in adult-onset immunodeficiency. Background: Autoantibodies against interleukin-12, anti-interleukin-12, are often identified in patients with thymoma, but opportunistic infections develop in only some of these patients. Interleukin-12, with subunits P40 and P35, shares a common subunit with interleukin-23, subunits P40 and P19. In a patient with disseminated Burkholderia gladioli infection, the identification of both anti-interleukin-23 and anti-interleukin-12 prompted further investigation. Methods. Among the patients, most of whom had thymoma, who were known to have anti-interleukin-12, we screened for autoantibodies against interleukin-23, anti-interleukin-23. To validate the potential role of anti-interleukin-23 with respect to opportunistic infection, we tested a second cohort of patients with thymoma as well as patients without either thymoma or known anti-interleukin-12 who had unusual infections. Results. Among 30 patients with anti-interleukin-12 who had severe mycobacterial, bacterial, or fungal infections, 50% also had autoantibodies that neutralized interleukin-23. The potency of such neutralization was correlated with the severity of these infections. The neutralizing activity of anti-interleukin-12 alone was not associated with infection. In the validation cohort of 91 patients with thymoma, the presence of anti-interleukin-23 was associated with infection status in 74 patients, 81%. Overall, neutralizing anti-interleukin-23 was detected in 30 of 116 patients, 26%, with thymoma, and in 30 of 36 patients, 83%, with disseminated, cerebral, or pulmonary infections. Anti-interleukin-23 was present in 6 of 32 patients, 19%, with severe intracellular infections, and in 2 of 16 patients, 12%, with unusual intracranial infections, including Cladophilophora bantiana and Mycobacterium avium complex. Conclusions. Among patients with a variety of mycobacterial, bacterial, or fungal infections, the presence of neutralizing anti-interleukin-23 was associated with severe, persistent opportunistic infections. Next, we will be discussing articles from Journal of American Medical Association. Vibration-controlled transient elastography scores to predict liver-related events in steatotic liver disease. Importance: metabolic dysfunction-associated steatotic liver disease, MOSLD, is currently the most common chronic liver disease worldwide. It is important to develop non-invasive tests to assess the disease severity and prognosis. Objective: to study the prognostic implications of baseline levels and dynamic changes of the vibration-controlled transient elastography, VCTE-based scores developed for the diagnosis of advanced fibrosis, AGIL-3+, and cirrhosis, AGIL-4, in patients with MOSLD. Design, setting, and participants: this cohort study included data from a natural history cohort of patients with MOSLD who underwent VCTE examination at 16 tertiary referral centers in the US, Europe, and Asia from February 2004 to January 2023, of which the data were collected prospectively at 14 centers. Eligible patients were adults aged at least 18 years with hepatic steatosis diagnosed by histologic methods, steatosis in greater than or equal to 5% of hepatocytes, or imaging studies, ultrasonography, computed tomography or magnetic resonance imaging, or controlled attenuation parameter greater than or equal to 248 decibels/m by VCTE. Results: a total of 16,603 patients underwent VCTE examination at baseline, mean SD, age, 52.5, 13.7, years, 9,600, 57.8%, were male. At a median follow-up of 51.7, IQR, 25.2 to 85.2, months, 316 patients, 1.9%, developed LREs. Both AGIL-3+ and AGIL-4 scores classified fewer patients between the low and high cutoffs than most fibrosis scores and achieved the highest discriminatory power in predicting LREs, integrated area under the time-dependent receiver operating characteristic curve, 0.89. A total of 10,920 patients, 65.8%, had repeated VCTE examination at a median interval of 15, IQR, 11.3 to 27.7, months and were included in the serial analysis. A total of 81.9% of patients, 7,208 of 8,810, had stable Agile 3 plus scores, and 92.6% of patients, 8,163 of 8,810, had stable Agile 4 scores, same risk categories at both assessments. The incidence of LREs was 0.6 per 1,000 person-years in patients with persistently low Agile 3 plus scores and 30.1 per 1,000 person-years in patients with persistently high Agile 3 plus scores. In patients with high Agile 3 plus score at baseline, a decrease in the score by more than 20% was associated with substantial reduction in the risk of LREs. A similar trend was observed for the Agile 4 score, although it missed more LREs in the low-risk group. Conclusions and relevance findings of this study suggest that single or serial Agile scores are highly accurate in predicting LREs in patients with MASLD, making them suitable alternatives to liver biopsy in routine clinical practice and in Phase 2b and 3 clinical trials for steatohepatitis. Skin biopsy detection of phosphorylated α-Synuclein in patients with Synucleinopathies. Objective to evaluate the positivity rate of cutaneous α-Synuclein deposition in patients with PD, DLB, MSA, and P. Design, setting, and participants. This blinded, 30-site, cross-sectional study of academic and community-based neurology practices conducted from February 2021 through March 2023 included patients aged 40 to 99 years with a clinical diagnosis of PD, DLB, MSA, or based on clinical consensus criteria and confirmed by an expert review panel, and can control participants aged 40 to 99 years with no history of examination findings or symptoms suggestive of a synucleinopathy or neurodegenerative disease. All participants completed detailed neurologic examinations and disease-specific questionnaires and underwent skin biopsy for detection of phosphorylated α-Synuclein. An expert review panel blinded to pathologic data determined the final participant diagnosis. Exposure skin biopsy for detection of phosphorylated α-Synuclein. Main outcomes: rates of detection of cutaneous α-Synuclein in patients with PD, MSA, DLB, and PIN controls without synucleinopathy. Results of 428 enrolled participants, 343 were included in the primary analysis. Mean SD, age, 69.5. 9.1 years, 175, 51.0%, male, 223 met the consensus criteria for a synucleinopathy and 120 met criteria as controls after expert panel review. The proportions of individuals with cutaneous phosphorylated α-Synuclein detected by skin biopsy were 92.7%, 89 of 96, with PD, 98.2%, 54 of 55, with MSA, 96.0%, 48 of 50, with DLB, and 100%, 22 of 22, with 3.3%, 4 of 120, of controls had cutaneous phosphorylated α-Synuclein detected. Conclusions and relevance in this cross-sectional study: a high proportion of individuals meeting clinical consensus criteria for PD, DLB, MSA, and PET phosphorylated α-Synuclein detected by skin biopsy. Further research is needed in unselected clinical populations to externally validate the findings and fully characterize the potential role of skin biopsy detection of phosphorylated α-Synuclein in clinical care. Next, we will be discussing articles from Annals of Internal Medicine. Association of low glomerular filtration rate with adverse outcomes at older age in a large population with routinely measured cystatin C. Background: the commonly accepted threshold of glomerular filtration rate, GFR, to define chronic kidney disease, CKD, is less than 60 ml per minute / 1.73 square meters. This threshold is based partly on associations between estimated GFR, (IGFR), and the frequency of adverse outcomes. The association is weaker in older adults, which has created disagreement about the appropriateness of the threshold for these persons. In addition, the studies measuring these associations included relatively few outcomes and estimated GFR on the basis of creatinine level, IGFR, which may be less accurate in older adults. Objective: to evaluate associations in older adults between IGFR versus IGFR based on creatinine and cystatin C levels, IGFR size, and 8 outcomes. Design: Population-based cohort study. Setting: Stockholm, Sweden, 2010 to 2019. Participants: 80 to 154 participants aged 65 years or older with outpatient creatinine and cystatin C testing. Measurements: hazard ratios for all-cause mortality, cardiovascular mortality, and kidney failure with replacement therapy, KFRT, incidence rate ratios for recurrent hospitalizations, infection, myocardial infarction or stroke, heart failure, and acute kidney injury. Results: the associations between exercise and outcomes were monotonic, but most associations for exercise were U-shaped. In addition, exercise was more strongly associated with outcomes than exercise. For example, the adjusted hazard ratios for 60 versus 80 milliliters per minute / 1.73 square meters for all-cause mortality were 1.2, 95% C, 1.1 to 1.3, for exercise and 1.0, C, 0.9 to 1.0, for exercise, and for KFRT they were 2.6, C, 1.2 to 5.8, and 1.4, C, 0.7 to 2.8, respectively. Similar findings were observed in subgroups, including those with a urinary albumin-creatinine ratio below 30 mg/g. Limitation: no GFR measurements. Conclusion: compared with low exercise in older patients, low exercise was more strongly associated with adverse outcomes and the associations were more uniform. Surgery, needle fasciotomy, or collagenase injection for Dupuytren contracture, a randomized controlled trial. Background: surgery, needle fasciotomy, and collagenase injection are used to treat Dupuytren contracture. The treatment decision requires balancing initial morbidity and costs of surgery against its potential long-term benefits over needle fasciotomy and collagenase. Objective: to compare the effectiveness of surgery, needle fasciotomy, and collagenase injection at 3 months and 2 years, secondary time points of the trial. Design: a multi-center, randomized, outcome assessor blinded, superiority trial. ClinicalTrials.gov, NCT 03192020 setting. 6 public hospitals in Finland. Participants: 302 persons with treatment-naive Dupuytren contracture angle less than 135 degrees. Intervention: surgery, N equals 101, needle fasciotomy, N equals 101, or collagenase, N equals 100. Measurements: the primary outcome was the success rate, defined as greater than 50% contracture release in patients reaching the patient-acceptable symptom state. Secondary outcomes included hand function, pain, quality of life, patient satisfaction, residual contracture angle, finger flexion, risk for retreatment, and serious adverse events. Results: a total of 292, 97%, and 284, 94%, participants completed the 3-month and 2-year follow-ups. Success rates were similar at 3 months, 71%, 95% C, 62% to 80%, for surgery, 73% C, 64% to 82%, for needle fasciotomy, and 73% C, 64% to 82%, for collagenase. At 2 years, surgery had superior success rates compared with both needle fasciotomy, 78% versus 50%, adjusted risk difference, ARD, 0.30, C, 0.17 to 0.43, and collagenase, 78% versus 65%, ARD, 0.13, C, 0.01 to 0.26. Secondary analyses paralleled with the primary analysis. Limitation: participants were not blinded. Conclusion: initial outcomes are similar between the treatments, but at 2-year success rates were maintained in the surgery group but were lower with both needle fasciotomy and collagenase despite retreatments. Next we will be discussing articles from British Medical Journal. Current safeguards, risk mitigation, and transparency measures of large language models against the generation of health disinformation, repeated cross-sectional analysis. Objectives to evaluate the effectiveness of safeguards to prevent large language models, LLMs, from being misused to generate health disinformation, and to evaluate the transparency of artificial intelligence (AI) developers regarding their risk mitigation processes against observed vulnerabilities. Design repeated cross-sectional analysis. Setting publicly accessible LLMs. Methods in a repeated cross-sectional analysis for LLMs via chatbot/assistant interfaces were evaluated. OpenAI's GPT-4 via ChatGPT and Microsoft's Copilot, Google's Palm 2 and newly released Gemini Pro via Bard, Anthropic's Claude 2 via Poe, and Meta's Llama 2 via Hugging Chat. In September 2023, these LLMs were prompted to generate health disinformation on two topics: sunscreen as a cause of skin cancer and the alkaline diet as a cancer cure. Jailbreaking techniques, attempts to bypass safeguards, were evaluated if required. Results: Claude 2 via Poe declined 130 prompts submitted across the two study time points requesting the generation of content claiming that sunscreen causes skin cancer or that the alkaline diet is a cure for cancer, even with jailbreaking attempts. GPT-4 via Copilot initially refused to generate health disinformation, even with jailbreaking attempts, although this was not the case at 12 weeks. In contrast, GPT-4 via ChatGPT, Palm 2/Gemini Pro via Bard, and Llama 2 via Hugging Chat consistently generated health disinformation blogs. In September 2023 evaluations, these LLMs facilitated the generation of 113 unique cancer disinformation blogs, totaling more than 40,000 words, without requiring jailbreaking attempts. The refusal rate across the evaluation time points for these LLMs was only 5%, 7 of 150, and has prompted the LLM-generated blogs incorporated attention-grabbing titles, authentic-looking, fake or fictional, references, fabricated testimonials from patients and clinicians, and they targeted diverse demographic groups. Although each LLM evaluated had mechanisms to report observed outputs of concern, the developers did not respond when observations of vulnerabilities were reported. Conclusions: This study found that although effective safeguards are feasible to prevent LLMs from being misused to generate health disinformation, they were inconsistently implemented. Furthermore, effective processes for reporting safeguard problems were lacking. Enhanced regulation, transparency, and routine auditing are required to help prevent LLMs from contributing to the mass generation of health disinformation. Next, we will be discussing articles from Lancet. Worldwide Trends in Underweight and Obesity from 1990 to 2022, a pooled analysis of 3,663 population representative studies with 222 million children, adolescents, and adults. Background: Underweight and obesity are associated with adverse health outcomes throughout the life course. We estimated the individual and combined prevalence of underweight or thinness and obesity, and their changes, from 1990 to 2022 for adults and school-aged children and adolescents in 200 countries and territories. Findings: From 1990 to 2022, the combined prevalence of underweight and obesity in adults decreased in 11 countries, 6% for women and 9% for men, with a posterior probability of at least 0.80 that the observed changes were true decreases. The combined prevalence increased in 162 countries, 81% for women, and 140 countries, 70% for men, with a posterior probability of at least 0.80. In 2022, the combined prevalence of underweight and obesity was highest in island nations in the Caribbean and Polynesia and Micronesia, and countries in the Middle East and North Africa. Obesity prevalence was higher than underweight, with posterior probability of at least 0.80 in 177 countries, 89% for women, and 73% for men in 2022, whereas the converse was true in 16 countries, 8% for women, and 20% for men. From 1990 to 2022, the combined prevalence of thinness and obesity decreased among girls in 5 countries, 3%, and among boys in 15 countries, 8%, with a posterior probability of at least 0.80, and increased among girls in 140 countries, 70%, and boys in 137 countries, 69%, with a posterior probability of at least 0.80. The countries with highest combined prevalence of thinness and obesity in school-aged children and adolescents in 2022 were in Polynesia and Micronesia and the Caribbean for both sexes, and Chile and Qatar for boys. Combined prevalence was also high in some countries in South Asia, such as India and Pakistan, where thinness remained prevalent despite having declined. In 2022, obesity in school-aged children and adolescents was more prevalent than thinness, with a posterior probability of at least 0.80 among girls in 133 countries, 67%, and boys in 125 countries, 63%, whereas the converse was true in 35 countries, 18%, and 42 countries, 21%, respectively. In almost all countries for both adults and school-aged children and adolescents, the increases in double burden were driven by increases in obesity, and decreases in double burden by declining underweight or thinness. Interpretation: the combined burden of underweight and obesity has increased in most countries, driven by an increase in obesity, while underweight and thinness remain prevalent in South Asia and parts of Africa. A healthy nutrition transition that enhances access to nutritious foods is needed to address the remaining burden of underweight while curbing and reversing the increase in obesity. Next, we will be discussing articles from Journal of Clinical Oncology. Neoadjuvant chemotherapy in high-grade myxoid liposarcoma, results of the expanded cohort of a randomized trial from Italian, ISG, Spanish, GEIS, French, FSG, and Polish sarcoma groups, PSG purpose. A randomized trial was conducted to compare neoadjuvant standard, S, anthracycline plus ifosfamide, AI, regimen with histology tailored, height, regimen in selected localized high-risk soft tissue sarcoma, STS. The results of the trial demonstrated the superiority of S in all STS histologies except for high-grade myxoid liposarcoma, HGMLPS, where S and height appeared to be equivalent. To further evaluate the non-inferiority of height compared with S, the HGMLPS cohort was expanded. Patients and methods. Patients had localized high-grade, cellular component greater than 5%, size greater than or equal to 5 cm, deeply seated MLPS of extremities or trunk wall. The primary endpoint was disease-free survival, DFS. The secondary endpoint was overall survival, OS. The trial used a non-inferiority Bayesian design, wherein height would be considered not inferior to S if the posterior probability of the true hazard ratio, HR, being greater than 1.25 was less than 5%. Results. From May 2011 to June 2020, 101 patients with HGMLPS were randomly assigned, 45 to the height arm and 56 to the S arm. The median follow-up was 66 months, IQR, 37 to 89. Median size was 107 mm, IQR, 84 to 143, 106 mm, IQR, 75 to 135, in the height arm and 108 mm, IQR, 86 to 150, in the S arm. At 60 months, the DFS and OS probabilities were 0.86 and 0.73, HR, 0.60, 95% C, 0.24 to 1.46, log rank P equals 0.26 for DFS, and 0.88 and 0.90, HR, 1.20, 95% C, 0.37 to 3.93, log rank P equals 0.77 for OS, in the height and S arms, respectively. The posterior probability of HR being greater than 1.25 for DFS met the Bayesian monitoring cutoff of less than 5%, 4.93%. This result confirmed the non-inferiority of trabectedin to AI suggested in the original study cohort. Conclusion. Trabectedin may be an alternative to standard AI in HGMLPS of the extremities or trunk when neoadjuvant treatment is a consideration. Next, we will be discussing articles from Journal of Hepatology. Global Survey of Stigma Among Physicians and Patients with Non-Alcoholic Fatty Liver Disease. Background and aims. Patients with fatty liver disease may experience stigma from the disease or comorbidities. In this cross-sectional study, we aim to understand stigma among patients with non-alcoholic fatty liver disease, NAFLD/non-alcoholic steatohepatitis, NASH, and healthcare providers. Methods. Members of the Global NASH Council created 2 surveys about experiences/attitudes toward NAFLD and related diagnostic terms, a 68-item patient and a 41-item provider survey. Results. Surveys were completed by 1,976 patients with NAFLD across 23 countries, 51% Middle East/North Africa, MENA, 19% Europe, 17% USA, 8% Southeast Asia, 5% South Asia, and 825 healthcare providers, 67% gastroenterologists/hepatologists, across 25 countries, 39% MENA, 28% Southeast Asia, 22% USA, 6% South Asia, 3% Europe. Of all patients, 48% ever disclosed having NAFLD/NASH to family/friends. The most commonly used term was fatty liver, 88% at least sometimes. Metabolic disease or MOFLD were rarely used, never by more than 84%. Regarding various perceptions of diagnostic terms by patients, there were no substantial differences between NAFLD, fatty liver disease, FLD, NASH, or MOFLD. The most popular response was being neither comfortable nor uncomfortable with either term, 56% to 71%, with slightly greater discomfort with FLD among the US and South Asian patients, 47 to 52% uncomfortable. Although 26% of patients reported stigma related to overweight/obesity, only 8% reported a history of stigmatization or discrimination due to NAFLD. Among providers, 38% believed that the term fatty was stigmatizing, while 34% believed that non-alcoholic was stigmatizing, more commonly in MENA, 43%, 42% providers, gastroenterologists/hepatologists 45% versus 37% other specialties, p equals 0.03, believe that the name change to metabolic dysfunction-associated steatotic liver disease, or MOSLD, might reduce stigma. Regarding the new nomenclature, the percentage of providers reporting steatotic liver disease as stigmatizing was low, 14%. Conclusions. The perception of NAFLD stigma varies among patients, providers, geographic locations, and subspecialties. Next, we will be discussing articles from Clinical Gastroenterology. Buprenorphine versus diclofenac for pain relief in acute pancreatitis, a double-blinded randomized controlled trial. Background. Although both nonsteroidal anti-inflammatory drugs, NSAIDs, and opioids are used for analgesia in acute pancreatitis, AP, the analgesic of choice is not known. We compared buprenorphine, an opioid, and diclofenac, an NSAID, for analgesia in AP. Methods. In a double-blind randomized controlled trial, AP patients were randomized to receive intravenous diclofenac or intravenous buprenorphine. Fentanyl was used as rescue analgesia, delivered through a patient-controlled analgesia pump. Primary outcome was the difference in the dose of rescue fentanyl required. Secondary outcomes were the number of effective and ineffective demands of rescue fentanyl, pain-free interval, reduction in visual analog scale, VAS, score, adverse events, and organ failure development. Results. 24 patients were randomized to diclofenac and 24 to buprenorphine. The two groups were matched at baseline. The total amount of rescue fentanyl required was significantly lower in the buprenorphine group, 130 g interquartile range, IQR, 80 to 255 versus 520 g, IQR, 380 to 1065, p less than 0.001. The number of total demands was 32, IQR, 21 to 69, in the diclofenac arm versus 8, IQR, 4 to 15, in the buprenorphine arm, p less than 0.001. The buprenorphine group had more prolonged pain-free interval, 20 versus 4 hours, p less than 0.001, with greater reduction in the VAS score at 24, 48, and 72 hours compared with the diclofenac group. These findings were confirmed in the subgroup of moderately severe/severe pancreatitis. Adverse events profile was similar in the two groups. Conclusions. Compared with diclofenac, buprenorphine appears to be more effective and equally safe for pain management in AP patients, even in the subcohort of moderately severe or severe pancreatitis. Sex differences in treatment response to nucleoside therapy in chronic hepatitis B, a multicenter longitudinal study. Background and aims. It is unclear if there may be sex differences in response to nucleoside analogues, including virologic response, VR, biochemical response, BR, complete response, CR, and hepatocellular carcinoma, HCC, incidence among hepatitis B patients. We compared nucleoside analog treatment outcomes by sex. Methods. We performed a retrospective cohort study of 3,388 treatment-naive adult hepatitis B patients, 1,250 female, 2,138 male, from the real-world evidence from the Global Alliance for the Study of Hepatitis B Virus Consortium, who initiated therapy with either entecavir or tenofovir from 22 sites: Argentina, Korea, Japan, Taiwan, and the United States. We used propensity score matching to balance background characteristics of the male and female groups and competing risks analysis to estimate the incidence and subdistribution hazard ratios, SHRs, of VR, BR, CR, and HCC. Results. Females versus males were older, 52.0 versus 48.6 years, less likely to be overweight/obese, 49.3% versus 65.7%, diabetic, 9.9% versus 13.1%, or cirrhotic, 27.9% versus 33.0%, and had a lower HBV DNA level, 5.9 versus 6.0 log 10 IU per milliliter, and alanine aminotransferase level, 91 versus 102 IU/L, all p less than 0.01. However, after propensity score matching, relevant background characteristics were balanced between the two groups. Females versus males had similar 5-year cumulative VR, 91.3% versus 90.3%, p equals 0.40, and HCC incidence rates, 5.1% versus 4.4%, p equals 0.64, but lower BR, 84.0% versus 90.9%, p less than 0.001, and CR, 78.8% versus 83.4%, p equals 0.016. Males were more likely to achieve BR, SHR, 1.31, 95% C, 1.17 to 1.46, p less than 0.001, and CR, SHR, 1.16, 95% C, 1.03 to 1.31, p equals 0.016, but VR and HCC risks were similar. Conclusions. Sex differences exist for treatment outcomes among hepatitis B patients. Male sex was associated with a 16% higher likelihood of clinical remission and a 31% higher likelihood of biochemical response than females, while virologic response and HCC incidence were similar between the two groups. Next, we will be discussing articles from Clinical Infectious Diseases. Emulating a target trial of shorter compared to longer course of antibiotic therapy for gram-negative bacteremia. Background. Despite the availability of antimicrobial therapies, gram-negative bacteremia remains a significant cause of morbidity and mortality on a global level. Recent randomized controlled trials support shorter antibiotic treatment duration for individuals with uncomplicated gram-negative bacteremia. The target trial framework using the cloning approach utilizes real-world data but eliminates the issue of immortal time bias seen in observational studies by emulating the analysis of randomized trials with full adherence. Method. A hypothetical target trial allocating individuals with gram-negative bacteremia to either short antibiotic treatment duration, 5 to 7 days, or longer antibiotic treatment duration, 8 to 14 days, was specified and emulated using the cloning, censoring, and weighting approach. The primary outcome was 90-day all-cause mortality. Secondary outcome was a composite endpoint of clinical and microbiological relapse. The emulated trial included individuals from 4 hospitals in Copenhagen from 2018 through 2021. Results. In sum, 1,040 individuals were included. The median age of the cohort was 76 years, the majority were male, 54%, had community-acquired gram-negative bacteremia, 86%, urinary tract infection is the source of the infection, 78%, and Escherichia coli is the pathogen of the infection, 73%. The adjusted 90-day risk difference in all-cause mortality was 1.3%, 95% confidence interval, C, -0.7, 3.3, and the risk ratio was 1.12, 95% C, 0.89, 1.37. The adjusted 90-day risk difference in relapse was 0.7%, 95% C, -2.3, 3.8, and the risk ratio was 1.07, 95% C, 0.71, 1.45. Conclusions. We found comparative outcomes for shorter treatment duration compared to longer treatment duration in patients with gram-negative bacteremia. Next, we will be discussing articles from Journal of Clinical Rheumatology. Persistent risk of developing autoimmune diseases associated with COVID-19, an observational study using an electronic medical record database in Japan. Objective. This study aimed to investigate the risk of developing autoimmune diseases associated with coronavirus disease 2019, COVID-19, in Japan, including long-term risks and risks specific to different variants of concern. Methods. This observational study used an electronic medical record database in Japan. The COVID-19 group is composed of patients diagnosed with COVID-19, whereas the non-COVID-19 group had data sampled from the database. The outcomes of interest encompass several autoimmune diseases, including rheumatoid arthritis, systemic sclerosis, and immunoglobulin G4-related disease, as well as a composite of these diseases, any autoimmune disease. We examined the relative risk of autoimmune diseases using standardized mortality ratio weighting in the Cox proportional hazards model. Subgroup analyses based on epidemic variants were performed. In addition, short and long-term risks were investigated using piecewise constant hazard models. Results. A total of 90,855 COVID-19 and 459,827 non-COVID-19 patients were included between January 16, 2020, and December 31, 2022. The relative risk of any autoimmune disease was 2.32, 95% confidence interval, 2.08 to 2.60. All the investigated outcomes showed a significant risk associated with COVID-19. Several autoimmune diseases exhibit a risk associated with COVID-19 in the short to long term, and the long-term risk is substantial for systemic sclerosis and immunoglobulin G4-related disease. The variant-specific risk varied across outcomes. Conclusions. COVID-19 is associated with an increased risk of developing autoimmune diseases in the Japanese population, and this effect persists for a long time. This study provides insights into the association between viral infections and autoimmunity. Next, we will be discussing articles from Arthritis and Rheumatology. Three-dimensional chromosomal landscape revealing miR146A dysfunctional enhancer in lupus and establishing a CRISPR-mediated approach to inhibit the interferon pathway. Objective. The diminished expression of microRNA 146A, miR146A, in systemic lupus erythematosus, SLE, contributes to the aberrant activation of the interferon pathway. Despite its significance, the underlying mechanism driving this reduced expression remains elusive. Considering the integral role of enhancers in steering gene expression, our study seeks to pinpoint the SLE-affected enhancers responsible for modulating miR146A expression. Additionally, we aim to elucidate the mechanisms by which these enhancers influence the contribution of miR146A to the activation of the interferon pathway. Methods. Circular chromosome conformation capture sequencing and epigenomic profiles were applied to identify candidate enhancers of miR146A. CRISPR activation was performed to screen functional enhancers. Differential analysis of chromatin accessibility was used to identify SLE dysregulated enhancers, and the mechanism underlying enhancer dysfunction was investigated by analyzing transcription factor binding. The therapeutic value of a lupus-related enhancer was further evaluated by targeting it in the peripheral blood mononuclear cells, PBMCs, of patients with SLE through a CRISPR activation approach. Results. We identified shared and cell-specific enhancers of miR146A in distinct immune cells. An enhancer 32.5 kilobits downstream of miR-146, it possesses less accessibility in SLE, and its chromatin openness was negatively correlated with SLE disease activity. Moreover, CSOT/enhancer binding protein alpha, a down-regulated transcription factor in patients with SLE, binds to the 32.5 kilobit enhancer and induces the epigenomic change of this locus. Furthermore, CRISPR-based activation of this enhancer in SLE PBMCs could inhibit the activity of interferon pathway. Conclusion. Our work defines a promising target for SLE intervention. We adopted integrative approaches to define cell-specific and functional enhancers of the SLE critical gene and investigated the mechanism underlying its dysregulation mediated by a lupus-related enhancer. Next, we will be discussing articles from Circulation. Arterial thromboembolism in patients with atrial fibrillation and CHA2DS2 VOSC score 1, a nationwide study. Background. Oral anticoagulation is suggested in patients with atrial fibrillation and a CHA2DS2 VOSC score greater than or equal to 1, congestive heart failure, hypertension, age greater than or equal to 75 years, diabetes, stroke, vascular disease, age 65 to 74 years, and sex score. To assess granular differences within CHA2DS2 VOSC1, the incidence of arterial thromboembolism according to CHA2DS2 VOSC1 subgroups was examined. Methods. The Danish National Patient Registry and the Danish Prescription Registry were linked on a nationwide level to identify patients with atrial fibrillation from 2000 to 2021 without oral anticoagulation and categorized according to CHA2DS2 VOSC score, CHA2DS2 VOSC 0, male and female subjects, CHA2DS2 VOSC 1, hypertension, heart failure, diabetes, vascular disease, and age 65 to 74 years, or CHA2DS2 VOSC 2, age greater than or equal to 75 years without other risk factors. Female sex was not considered a risk factor in any risk group. The outcome was arterial thromboembolism, ischemic stroke, embolism of extremity, or transient cerebral ischemia. Study groups were compared using Cox regression analysis. Results. We included 26,701 patients with a CHA2DS2 VOSC 0 score, 22,915 with CHA2DS2 VOSC 1, 1,483 patients with heart failure, 9,066 with hypertension, 843 with diabetes, 770 with vascular disease, and 10,753 who were 65 to 74 years of age, and 14,525 patients with CHA2DS2 VOSC 2, greater than or equal to 75 years of age without other risk factors. With a median of 1 year of observation time, the cumulative incidence of arterial thromboembolism was 0.6%, n equals 154, 95% C, 0.6% to 0.8%, 1.4%, n equals 16, 95% C, 0.8% to 2.2%, 1.9%, n equals 141, 95% C, 1.6% to 2.2%, 1.7%, n equals 12, 95% C, 0.9% to 2.9%, 2.0%, n equals 13, 95% C, 1.1% to 3.4%, 2.3%, n equals 187, 95% C, 2.0% to 2.7%, and 4.4%, n equals 533, 95% C, 4.1% to 4.8%, for CHA2DS2 VOSC 0, heart failure, hypertension, diabetes, vascular disease, age 65 to 74 years, CHA2DS2 VOSC 1, and age greater than or equal to 75 years, CHA2DS2 VOSC 2, respectively. No statistically significant difference was identified among subgroups of CHA2DS2 VOSC 1, p equals 0.15 for difference. Conclusions. For patients with atrial fibrillation, all subgroups of CHA2DS2 VOSC 1 were associated with lower incidence of arterial thromboembolism compared with age greater than or equal to 75 years without other risk factors, e. CHA2DS2 VOSC 2, and a higher incidence compared with CHA2DS2 VOSC 0. No statistically significant difference was identified between the subgroups of CHA2DS2 VOSC 1. These findings support current recommendations that patients within this intermediate risk group could be identified with a similar risk of arterial thromboembolism. Next, we will be discussing articles. American College of Cardiology. TAVR or SAVR in severe aortic stenosis and small aortic annulus. Study questions. What are the hemodynamic and clinical outcomes after transcatheter aortic valve replacement, TAVR, and surgical aortic valve replacement, SAVR, among patients with severe aortic stenosis, AS, and a small aortic annulus? Methods. The VIVA trial was a prospective, randomized trial conducted in 15 centers in Canada, Europe, and Brazil that included 151 patients greater than or equal to 65 years old with severe AS and small aortic annulus, mean aortic diameter less than 23 mm and minimal diameter less than 21.5 mm on computed tomography, randomized 1:1 to TAVR, N equals 77, versus SAVR, N equals 74. Results. Mean age was 75.5 plus or minus 5.1 years, 140, 93%. Patients were women. The median Society of Thoracic Surgeons, STS, predicted risk of mortality, PROM, was 2.50%, interquartile range, IQR 1.67% to 3.28%, and median annulus diameter was 21.1 mm, IQR 20.4 to 22.0 mm. A self-expanding valve was used in 59.2% of patients in the TAVR group, a bioprosthesis, Magna-Ease, Inspirus Resilia, Percival, Braille Biomedica, Trifecta, Avalis, Mitraflow, Intuiti Elite, was used in all but one patient in the SAVR group, and 7% of SAVR patients underwent concomitant root enlarging procedure. There were no statistically significant differences between groups in the rates of severe PPM, 4, 5.6%, TAVR versus 7, 10.3%, SAVR, P equals 0.30, and moderate severe R, none in either group. Mean aortic gradient at 60 days was 11 plus or minus 5 mm Hg in both groups, P equals 0.70. At 30 days, SAVR was associated with a higher incidence compared to TAVR of major/life-threatening bleeding, 21.6% versus 9.1%, P equals 0.03, and new onset AF, 27.0% versus 6.5%. No significant differences were found between groups in 30-day mortality, 1, 1.3%, TAVR versus 1, 1.4%, SAVR, P equals 1.00, and stroke, 0 TAVR versus 2, 2.7%, SAVR, P equals 0.24. After a median follow-up of 2 years, IQR 4 years, there were no differences between groups in mortality, 7, 9.1%, TAVR versus 6, 8.1%, SAVR, P equals 0.89, stroke, 3, 3.9%, TAVR versus 3, 4.1%, SAVR, P equals 0.95, and cardiac hospitalization, 15, 19.5%, TAVR versus 15, 20.3%, SAVR, P equals 0.80. Conclusions. There was no evidence of hemodynamic superiority of contemporary TAVR versus SAVR among patients with severe AS and small aortic annulus, and after a median follow-up of 2 years, there were no differences in clinical outcomes between groups except for a higher rate of new onset AF after SAVR. The authors conclude that these findings suggest that the two therapies are valid alternatives for treating patients with severe AS and small aortic annulus and that treatment likely should be individualized, but that the results of the study should be interpreted with caution because of the limited sample size leading to an underpowered study with a need for confirmation in future larger studies. Next, we will be discussing articles from journals of the American College of Cardiology. Angiotensin receptor neprilysin inhibition in patients with STEMI versus NSTEMI. Background. Patients who sustain an acute myocardial infarction, AMI, including ST segment elevation myocardial infarction, STEMI, and non-ST segment elevation myocardial infarction, STEMI, remain at high risk for heart failure, HF, coronary events, and death. Angiotensin-converting enzyme inhibitors have been shown to significantly decrease the risk for cardiovascular events in both STEMI and STEMI patients. Objectives. The objectives were to determine whether angiotensin receptor blockade and neprilysin inhibition with sacubitril/valsartan, compared with ramipril, has impact on reducing cardiovascular events according to the type of AMI. Methods. The Paradise-ME, prospective ARNI versus ACE inhibitor trial to determine superiority in reducing heart failure events after myocardial infarction. Trial enrolled patients with AMI complicated by left ventricular dysfunction and/or pulmonary congestion, and at least one risk-enhancing factor. Patients were randomized to either sacubitril/valsartan or ramipril. The primary endpoint was death from cardiovascular causes or incident HF. In this pre-specified analysis, we stratified patients according to AMI type. Results. Of 5,661 enrolled patients, 4,291, 75.8%, had STEMI. These patients were younger and had fewer comorbidities and cardiovascular risk factors than STEMI patients. After adjustment for potential confounders, the risk for the primary outcome was marginally higher in STEMI versus STEMI patients. Adjusted HR, 1.19, 95% C, 1.00 to 1.41, with borderline statistical significance, p equals 0.05. The primary composite outcome occurred at similar rates in patients randomized to sacubitril/valsartan versus ramipril in STEMI, 10% versus 12%, HR, 0.87, 95% C, 0.73 to 1.04, p equals 0.13, and STEMI patients, 17% versus 17%, HR, 0.97, 95% C, 0.75 to 1.25, p equals 0.80, p interaction equals 0.53. Conclusions. Compared with ramipril, sacubitril/valsartan did not significantly decrease the risk for cardiovascular death and HF in patients with AMI complicated by left ventricular dysfunction, irrespective of the type of AMI. Prospective ARNI versus ACE inhibitor trial to determine superiority in reducing heart failure events after ME. Next, we will be discussing articles from Journal of Clinical Endocrinology and Metabolism. High incidence of diabetes mellitus after distal pancreatectomy and its predictors, a long-term follow-up study. Abstract. Context. Glucose tolerance worsens after distal pancreatectomy, DP. However, the long-term incidence and factors affecting interindividual variation in this worsening are unclear. Objective. To investigate the changes in diabetes-related traits before and after DP and to clarify the incidence of diabetes and its predictors. Methods. Among 493 registered patients, 117 underwent DP. Among these, 56 patients without diabetes before surgery were included in the study. Glucose and endocrine function were prospectively assessed using a 75-gram oral glucose tolerance test preoperatively, 1 month after DP, and every 6 months thereafter for up to 36 months. Pancreatic volumetry was performed using multi-detector row-computed tomography before and after surgery. Results. Insulin secretion decreased and blood glucose levels worsened after DP. Residual pancreatic volume was significantly associated with the reserve capacity of insulin secretion but not with blood glucose levels or the development of diabetes. Among 56 patients, 33 developed diabetes mellitus. The cumulative incidence of diabetes at 36 months after DP was 74.1%. Multivariate Cox regression analysis showed that impaired glucose tolerance as a preoperative factor as well as a decreased insulinogenic index and impaired glucose tolerance at 1 month postoperatively were identified as risk factors for diabetes following DP. Conclusion. Impaired glucose tolerance and reduced early-phase insulin response to glucose are involved in the development of new-onset diabetes after DP. The latter is an additional factor in the development of diabetes and becomes apparent when pancreatic beta cell mass is reduced after DP. Next, we will be discussing articles from Neurology. Effect of evobrutinib on slowly expanding lesion volume in relapsing multiple sclerosis, a post hoc analysis of a phase 2 trial. Background and objectives. Chronic active lesions, CALs, are demyelinated multiple sclerosis, MS, lesions with ongoing microglia/macrophage activity, resulting in irreversible neuronal damage and axonal loss. Evobrutinib is a highly selective, covalent, CNS-penetrant, Bruton tyrosine kinase inhibitor. This post-hoc analysis evaluated the effect of evobrutinib on slowly expanding lesion, SEL, volume, and MRI marker of CALs, assessed baseline week 48 in a Phase 2, double-blind, randomized trial, NCT 02975349, in relapsing MS, RMS. Methods. In the 48-week, double-blind trial, adult patients received evobrutinib, 25 mg once daily, QD, 75 mg QD, or 75 mg twice daily, BID, placebo, switched to evobrutinib 25 mg QD after week 24, or open-label dimethyl fumarate, DMF 240 mg BID. Cells were defined as slowly and consistently radially expanding areas of pre-existing T2 lesions of greater than or equal to 10 contiguous voxels, 30 cubic millimeters, over time. Cells were identified by MRI and assessed by the Jacobian determinant of the nonlinear deformation from baseline to week 48. Cell volume analysis, stratified by baseline T2 lesion volume turtles, was based on week 48/end of treatment status, completers/non-completers. Treatment effect was analyzed using the stratified Hodges-Lehmann estimate of shift in distribution and stratified Wilcoxon rank sum test. Comparisons of evobrutinib and DMF versus placebo/evobrutinib 25 mg QD were made. Subgroup analyses used pooled treatment groups, evobrutinib high dose, 75 mg QD/BID, versus low dose, placebo/evobrutinib 25 mg QD. Results. The cell analysis set included 223 patients, mean SD, age, 42.4, 10.7 years, 69.3% female, 87.4% relapsing/remitting MS. Mean SD, cell volume was 2099, 2981.0, 3 with evobrutinib 75 mg BID versus 2681, 3624.2, 3 with placebo/evobrutinib 25 mg QD. Median number of cells/patient ranged from 7 to 11 across treatments. Cell volume decreased with increasing evobrutinib dose versus placebo/evobrutinib 25 mg QD, and no difference with DMF versus placebo/evobrutinib 25 mg QD was noted. Cell volume significantly decreased with evobrutinib 75 mg BID versus placebo/evobrutinib 25 mg QD, minus 474.5 cubic millimeters, minus 1098.0 to minus 3.0, p equals 0.047, and versus DMF, minus 711.6, minus 1290.0 to minus 149.0, p equals 0.011. Cell volume was significantly reduced for evobrutinib high versus low dose within baseline expanded disability status scale greater than or equal to 3.5 and longer disease duration, greater than or equal to 8.5 years, subgroups. Discussion. Evobrutinib reduced cell volume in a dose-dependent manner in RMS, with a significant reduction with evobrutinib 75 mg BID. This is evident that evobrutinib affects brain lesions associated with chronic inflammation and tissue loss. Next, we will be discussing articles from CHEST. Preserved ratio impaired spirometry and COPD accelerate frailty progression. Background. COPD has been found to be associated with frailty. However, longitudinal evidence for associations of COPD with frailty progression is inadequate. Furthermore, recent studies revealed a new phenotype of lung function impairment, preserved ratio impaired spirometry, PRISM, findings. Associations of PRISM findings and their transitions with frailty progression are unclear. Research question. What are the associations of PRISM findings, transitions of PRISM findings, and COPD with frailty progression? Study design and methods. To analyze the associations of PRISM findings and COPD with frailty progression, 5,901 patients were included from the English longitudinal study of aging. Patients were classified into 3 lung function patterns of normal spirometry, NS, findings, PRISM findings, and COPD. Frailty progression was assessed by repeated measurements of the frailty index, Phi, during follow-up. Among these 5,901 patients, 3,765 patients were included to analyze the associations of PRISM findings transitions with frailty progression. PRISM findings transitions were assessed based on the changes of lung function patterns after a 4-year interval. Linear mixed effect models were used for statistical analyses. Results: the median follow-up periods were 9.5 years for the analyses of PRISM findings and COPD with frailty progression and 5.8 years for PRISM findings transitions with frailty progression. When compared with participants with NS findings, patients with PRISM findings and COPD demonstrated accelerated Phi progression with additional annual increases of 0.301, 95% C, 0.211 to 0.392. P less than 0.001 and 0.172, 95% C, 0.102 to 0.242, P less than 0.001 respectively. Patients who transitioned from NS findings to PRISM findings also demonstrated accelerated Phi progression when compared with those with stable NS findings, beta equals 0.242, 95% C, 0.008 to 0.476, P equals 0.042. However, no accelerated Phi progression was found in patients with PRISM findings who transitioned to NS findings, beta equals 0.119, 95% C, minus 0.181 to 0.418, P equals 0.438. Interpretation: our findings indicate that PRISM findings and COPD are associated with accelerated frailty progression. Further studies are needed to elucidate the causality of the association of PRISM findings and COPD with frailty. Changes in respiratory mechanics with trunk inclination differs between patients with ARDS with and without obesity. Background: studies investigating the effect of trunk inclination on respiratory mechanics in mechanically ventilated patients with ARDS have reported postural differences in partition respiratory mechanics. Compared with more upright positions, the supine flat position provided lower lung and chest wall elastance, allowing reduced driving pressures and end inspiratory transpulmonary pressure. However, the effect of trunk inclination on respiratory mechanics in patients with obesity and ARDS is uncertain. Research question: does the effect of change in posture on partition respiratory mechanics differ between patients with ARDS with and without obesity? Study design and methods. In this single-center study, patients with ARDS with and without obesity were randomized into 2 15-minute steps in which trunk inclination was changed from semi-recumbent, 40 degrees head up, to supine flat, 0 degrees, or vice versa. At the end of each step, partition respiratory mechanics, airway opening pressure, and arterial blood gases were measured. Paired t-test was used to examine respiratory mechanics and blood gas variables in each group. Results: 40 consecutive patients were enrolled. 20 were obese, BMI 38.4, 34.5 to 42.3, and 20 were non-obese, BMI 26.6, 25.2 to 28.5. In the patients with obesity, lung and chest wall elastance, driving pressure, inspiratory transpulmonary pressure, PaCO2, and ventilatory ratio were lower supine than semi-recumbent, P less than 0.001. Airways resistance was greater supine, P equals 0.006. In the patients without obesity, only chest wall elastance was lower in supine versus semi-recumbent, P less than 0.001. Interpretation: in mechanically ventilated patients with ARDS and obesity, supine posture provided lower lung and chest wall elastance, and better CO2 clearance, than the semi-recumbent posture. Prospective evaluation of venous access ultrasound for estimation of venous congestion. Background: venous access ultrasound, VEXUS, is a novel ultrasound technique previously reported as a non-invasive measure of venous congestion and predictor of cardiorenal acute kidney injury. Research question: Are there associations between VEXAS grade and cardiac pressures measured by right heart catheterization, RHC, and cardiac biomarkers and clinical outcomes in patients undergoing RHC? Study design and methods. We conducted a prospective cohort study at the Denver Health Medical Center from December 20, 2022 to March 25, 2023. All patients undergoing RHC underwent a blinded VEXAS assessment prior to their procedure. Multivariable regressions were conducted to assess relationships between VEXAS grade and cardiac pressures, biomarkers, and changes in weight among patients with heart failure, a proxy for diuretic success. Receiver operating characteristic curve and area under the curve, AUC, were derived for VEXAS, inferior vena cava, IVC, diameter, and IVC collapsibility index, ICI, to predict right atrial pressure, RAP, greater than 10 and less than 7 mm Hg. Results. Among 81 patients, 45 of whom were inpatients, after adjusting for age, sex, and Charlson Comorbidity Index, there were significant relationships between VEX-US greater 2, beta equals 4.8, 95% C, 2.6 to 7.1, P less than 0.01, and 3, beta equals 11, 95% C, 8.9 to 14, P less than 0.01, and RAP, VEXAS grade of 2, beta equals 6.8, 95% C, 0.16 to 13, P equals 0.045, and 3, beta equals 15, 95% C, 7.3 to 22, P less than 0.01, and mean pulmonary artery pressure and VEXAS grade of 2, beta equals 7.0, 95% C, 3.9 to 10, P less than 0.01, and 3, beta equals 13, 95% C, 9.5 to 17, P less than 0.01, and pulmonary capillary wedge pressure. AUC values for VEXAS, IVC diameter, and EC as predictors of RAP greater than 10 mm Hg were 0.9, 95% C, 0.83 to 0.97, 0.77, 95% C, 0.68 to 0.88, and 0.65, 95% C, 0.52 to 0.78, respectively. AUC values for VEXAS, IVC diameter, and EC as predictors of RAP less than 7 mm Hg were 0.79, 95% C, 0.70 to 0.87, 0.74, 95% C, 0.64 to 0.84, and 0.62, 95% C, 0.49 to 0.76, respectively. In a subset of 23 patients with heart failure undergoing diuresis, there was a significant association between VEXAS grade 3 and change in weight between time of RHC and discharge, p equals 0.025. Interpretation. Although more research is required, VEXAS has the potential to increase diagnostic and therapeutic capabilities of physicians at the bedside and increase our understanding of the underappreciated problem of venous congestion. Next, we will be discussing articles from the American Journal of Respiratory and Critical Care Medicine. Extracorporeal carbon dioxide removal to avoid invasive ventilation during exacerbations of chronic obstructive pulmonary disease, VENTAVOID trial, a randomized clinical trial. Rationale: it is unclear whether extracorporeal CO2 removal, ECHO2R, can reduce the rate of intubation or the total time on invasive mechanical ventilation, IMV, in adults experiencing an exacerbation of chronic obstructive pulmonary disease, COPD. Objectives: to determine whether ECHO2R increases the number of ventilator-free days within the first 5 days post-randomization, VFD5, in exacerbation of COPD in patients who are either failing non-invasive ventilation, NIV, or who are failing to wean from IMV. Methods: this randomized clinical trial was conducted in 41 U.S. institutions, 2018 to 2022, clinicaltrials.gov ID, NCT 03255057. Subjects were randomized to receive either standard care with venovenous ECHO2R, NIV stratum, N equals 26, IMV stratum, N equals 32, or standard care alone, NIV stratum, N equals 22, IMV stratum, N equals 33. Measurements and main results: the trial was stopped early because of slow enrollment and enrolled 113 subjects of the planned sample size of 180. There was no significant difference in the median VFD5 between the arms controlled by strata, p equals 0.36. In the NIV stratum, the median VFD5 for both arms was 5 days, median shift equals 0.0, 95% confidence interval, c. 0.0 to 0.0. In the IMV stratum, the median VFD5 in the standard care and echo-2R arms were 0.25 and 2 days, respectively, median shift equals 0.00, 95% confidence interval, 0.00 to 1.25. In the NIV stratum, all-cause in-hospital mortality was significantly higher in the echo-2R arm, 22% versus 0%, p equals 0.02, with no difference in the IMV stratum, 17% versus 15%, p equals 0.73. Conclusions: in subjects with exacerbation of COPD, the use of echo-2R compared with standard care did not improve VFD5. Next we will be discussing articles is from Clinical Journal of American Society of Nephrology. Association of bioimpedance parameters with increases in blood pressure during hemodialysis. Background: intradialytic hypertension, defined as an increase in BP from pre to post hemodialysis, HT, affects 5% to 15% of patients receiving maintenance HT and is associated with cardiovascular and all-cause mortality. Hypervolemia is believed to be a major etiological factor, yet the association of more objective biomarkers of volume status with intradialytic hypertension is not well described. Methods: in a post-hoc analysis of the frequent hemodialysis network daily trial, N equals 234, using data from baseline, 1, 4, and 12-month visits, N equals 800, we used random effects regression to assess the association of bioimpedance estimates of volume, vector length, with post-HD systolic BP, continuous, and any increase in systolic BP, categorical, from pre to post-HD. We adjusted models for randomized group, age, sex, self-reported race, Kitley body mass index, vascular access, HD vintage, hypertension, history of heart failure, diabetes, residual kidney function, urea clearance, pre-HD systolic BP, ultrafiltration rate, serum dialysate sodium gradient, and baseline values of hemoglobin, phosphate, and equilibrated KT/V urea. Results: the mean age of participants was 50 plus or minus 14 years, 39% were female, and 43% were Black. In adjusted models, shorter vector length, per 50 ohm/m, was associated with higher post-HD systolic BP, 2.9 mm Hg, 95% confidence interval, c. 1.6 to 4.3, and higher odds of intradialytic hypertension, odds ratio 1.66, 95% c. 1.07 to 2.55. Similar patterns of association were noted with a more stringent definition of intradialytic hypertension, greater than 10 mm Hg increase from pre to post HD systolic BP, where shorter vector length, per 50 ohm/m, was associated with a higher odds of intradialytic hypertension, odds ratio 2.17, 95% c. 0.88 to 5.36. Conclusions: shorter vector length, a bioimpedance-derived proxy of hypervolemia, was independently associated with higher post-HD systolic BP and risk of intradialytic hypertension. Drug-coated balloon angioplasty for dysfunctional arteriovenous hemodialysis fistulae, a randomized controlled trial. Background: the aim of this study was to evaluate the efficacy and safety of paclitaxel-coated balloons, A.C.O. Art-Orchid, in treating dysfunctional arteriovenous fistulae. Methods: the drug-eluting balloon for arteriovenous AV fistula in China trial was a prospective, multi-center, randomized controlled study. Patients who had greater than or equal to 50% venous stenosis of the AV fistula and symptoms indicating significant hemodynamic changes were included. After successful predilation with a high-pressure balloon, residual stenosis less than or equal to 30%, patients were randomized 1-to-1 to either a paclitaxel-coated balloon or an uncoated control balloon. The primary efficacy outcome was assessed at 6 months, and safety assessment was conducted within 30 days of the procedure. The 12-month results were also analyzed. Results. The study included 244 patients, equally distributed between the two groups. The primary target lesion patency was 91%, 106-116 for the drug-coated balloon, DCB, group and 67%, 79-118 for the plain balloon catheter group, representing a difference of 24.63%, 95% confidence interval, 14.68 to 34.58, p less than 0.001. The secondary efficacy endpoint was primary target lesion patency at 12 months, which was 66%, 74-112, for the DCB group and 46%, 52-112, for the plain balloon catheter group, 95% confidence interval, 6.57 to 32.08, p equals 0.004. The mean number of reinterventions per patient to maintain target lesion patency during the 12 months after the index procedure was 0.39, 48-122, in the DCB group and 0.77, 94-122, in the plain balloon catheter group, p equals 0.001. The primary safety endpoint did not differ between groups, p equals 0.25. Conclusions. A.I.O. Art-Orchid DCB showed better primary patency rates compared with plain balloon angioplasty for treating stenotic lesions in dysfunctional hemodialysis AV fistulae at 6 and 12 months. It required fewer repeated interventions and had comparable safety in 1 year. Next we will be discussing articles is from Kidney International Reports. Ecological momentary assessment to explore fatigue, mood, and physical activity levels in people receiving peritoneal dialysis. Introduction. Fatigue is a frequent and debilitating symptom that contributes to poor quality of life for people receiving peritoneal dialysis. Ecological momentary assessment using mobile technology, MIMA, is a novel survey technique that can collect symptom data in real time and has not been trialed in a peritoneal dialysis cohort. The study aimed to explore real-time fluctuations and associations between fatigue, mood, and physical activity using MIMA. Methods. Adults receiving peritoneal dialysis completed fatigue and mood scales via a mobile application, app, 5 times daily for 7 days and concurrently wore an accelerometer. A feasibility questionnaire was completed on the 8th day. Results. 48 adults completed the study. Within-day fatigue fluctuations were observed with severity lowest during mid-morning to early afternoon and peaking at bedtime. Associations between fatigue and mood were observed with a 1-unit change in mood score conferring a 5.2-unit change in fatigue, p less than 0.01. Higher volume of physical activity was associated with lower fatigue and enhanced mood. Overall adherence to the app-based surveys was 73%, with most participants reporting mobile phones and the MIMA app being easy to use. Conclusion. People receiving peritoneal dialysis experience within-day and day-to-day fluctuations in fatigue that appear highly variable. Higher fatigue severity was associated with poorer mood and lower physical activity levels, with future studies required to explore if physical activity-based interventions could be a potential strategy for the management of these symptoms. Furthermore, MIMA and mobile phones were feasible to capture symptom data with potential to be employed in future research or as part of improved care. Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.